Hi guys, today I'm going to be talking about prostate cancer. It is defined as growth of malignant cells in the prostate gland. It is a cancer that occurs in the prostate. It's a small walnut-shaped gland in men that produces a seminal fluid that nourishes and transports sperm. Prostate cancer is one of the most common types of cancer in men. It usually grows slowly and is initially confined to the prostate gland, where it may not cause serious harm. However, while some types of prostate cancer grow slowly and may need minimal or even no treatment, other types are aggressive and can spread quickly. Prostate cancer that's detected early when it's still confined in the gland has a better chance of successful treatment. Most prostate cancers do not have an identifiable cause, and triggers for cancer growth are still unknown. But doctors have found many factors that raise the risk of developing the disease, and prostate cancer is the fourth most prevalent cancer in the world, with over 1 million cases diagnosed in 2018. Some of those risks are excessive weight, the aging process, ethnic origin, hereditary factors, lack of exercise, the role of height, a previous cancer, prostate inflammation may also have a possible link, and the role of diet. People with a diet rich in calcium appear to have a greater risk of developing prostate cancer. In contrast, men who include tomatoes and red fruits in their diets may be less likely to get the disease. About 1 in 9 men will be diagnosed with prostate cancer during his lifetime, and is more likely to develop in older men and in African American men. So about 6 out of 10 cases that are diagnosed in men, the men are 65 or older. It is rare for men under 40 to be diagnosed with that. Prostate cancer is usually very slow growing cancer, often causing no symptoms until it's in the advanced stages. So most men with prostate cancer die of other causes and may never even know that they had the disease. But once prostate cancer begins to grow quickly or spreads outside the prostate, that's when it becomes dangerous. And you have risks of urinary tract infection, kidney infections, trouble urinating. It could decrease the force of the stream of your urine, blood in your semen, discomfort in the pelvic area, bone pain, erectile dysfunction. Now, there's a few different ways to get diagnosed. Rectal examination, it's done in the office there. PSA blood test, transrectal ultrasound, and then a biopsy. A core needle biopsy is the main method used to diagnose prostate cancer. It's usually done by a urologist, and during the biopsy, the doctor usually looks at the prostate with an imaging test such as the transrectal ultrasound or an MRI or a fusion of both of them. Now, though the biopsy procedure sounds painful, each biopsy usually causes only some brief discomfort because it's done with a special spring-loaded biopsy instrument, and the device inserts and removes the needle in a fraction of a second. So most doctors who do the biopsy will numb the area first by injecting local anesthetic, and then the biopsy itself takes about 10 minutes, and it's usually done just right in the doctor's office. Depending on the stage of cancer, this will determine the outcome. So almost 100% of men who have local or regional prostate cancer will survive more than 5 years after diagnosis. Fewer men, about 7%, have more advanced prostate cancer at the time of their diagnosis. And once prostate cancer has spread beyond the prostate, survival rates do fall. And once the cancer has advanced and spread past the prostate, and with their chosen treatment, whether it be surgery, radiation, 3% of patients expected to live fewer than 5 years, 9% said to live 5 to 10 years, 33% have 10 to 20 years, and then over half, 55%, said more than 20 years. So once prostate cancer has been diagnosed, graded, and staged, there's a lot to consider before someone chooses their treatment plan. The treatment you choose for prostate cancer should also take into account your age, your expected lifespan, personal preferences and feelings about side effects associated with each treatment, any other previous health conditions you have, and the stage and grade of the cancer. So these are some of the medical treatments that are out there. We have surgery, radiation therapy, hormone therapy, chemotherapy, watchful waiting, and not so much medical, but diet. A lot more men are looking for alternative medicine, and diet is another way to help treat prostate cancer, but more studies do need to be done for the outcome of this treatment. Is prostate cancer curable? Can it be cured? So the short answer is yes, prostate cancer can be cured when detected and treated early. The vast majority of prostate cancer cases, more than 90%, are discovered in the early stages, making the tumors more likely to respond to treatment. But treatment doesn't always have to mean surgery or chemotherapy either. So here's a video, 2.5 minutes, I guess it would be, on some advanced treatments they have going now.
Advanced prostate cancer has progressed beyond the actual prostate gland. And the question is, are we still able to cure prostate cancer at that stage? Prostate cancer has a very variable disease course, with some patients having a very slow-growing disease, even if the cancer has spread beyond the prostate, and other ones have very aggressive disease course. So the question whether we can cure the patient will primarily depend on what kind of prostate cancer they have. In the so-called local regional progression, meaning the cancer has spread to the lymph nodes in the pelvis, there is still a real fraction of the patient that can be cured with a combination of radiotherapy and hormone deprivation therapy. Once the disease has progressed to a further stage, for example, involving the bones or other organs, then our goal, unfortunately, at this point is to prolong survival. And we are having more and more drugs approved recently to help us with that goal. Obviously, the next step of research for us is to start to combine these newly developed drugs to see whether we can achieve a real cure in a subset of those patients with very advanced cancer.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is, so most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed, but right now a man can't be sure if his cancer is the kind that is likely to require treatment, or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.
Okay, thank you. That's everything.